as part of efforts to eliminate malaria in Nigeria, especially reducing malaria morbidity in children. Stakeholders are seeking ways to prevent and reduce the high level of malaria in Nigeria. Malaria Consortium with other stakeholders like WHO, NAFDAC, primary health care, academia, among others, held a two-day meeting on research uptake of malaria for perennial malaria chemo prevention intervention being piloted in Nigeria. The aim is for the country to adopt the intervention, which is currently going through needed researches and feedbacks to ascertain post-uptake results and necessary adjustments, if necessary, for adequate prevention of malaria amongst children. The Minister of Health, Dr. Tunji Alausa, expressed his delight on the efforts towards data coalition and other efforts. He promised the adoption of results into national plan for malaria elimination.
So that's and we did, and it's the same thing. We're doing the same thing. If you continue to do the same thing over and over and over again, you would not get different results. You'll continue to get the same results. And part of the problem we've had is that there's so much hyper-fragmentation in the way our programs are being designed. The malaria program is designed in the country, and no coordination. You have a PMI in some states, PMI foundation in some of the other states, and a global fund in some states. And there's really no coordination. And then the way interventions were given, we're not necessarily focusing into what works. We go to Kebbi State where you have the rice, what do you call it? Rice, yes. Then you were still using high TN. In some areas, mosquitoes are biting during the day. And there are lots of resources that we could use, but some of them are more costly, some of them are less costly. And there are new interventions and new things that we could use as in form of vaccine, which we have to deploy everything.
Stakeholders also spoke about the success of the research uptake so far, saying the uptake project of the PMC is a strategy program that works towards prevention and elimination of malaria in Nigeria. They also spoke about the aims and objectives of the program.
Preliminary findings of the pilot study for stakeholders to review, make recommendations and propose strategies to improve study implementation, to guide decision-making on PMC policy adoption using available evidence from research findings, and to present and finalize PMC logo for the purpose of branding in readiness for rollout. So those are our objectives.
At this meeting, this phase of this meeting, we're very happy with the results that we're getting in the field. Is speaking to the positivity of Nigeria adopting this intervention for the children of this country. And this intervention, like the name goes, is going to be deployed in the southern part of the country, where we have the perennial rainfall.
How many states are it?
So they are mainly the states in the southern part of the country. You have like my state, Abia State, you have Ebonyi State, you have Enugu State. There are also some states in the north central that will benefit from this intervention for the children under 5, specifically from 2 months to 24 months old children. And this program, this intervention, it's going to be running under the immunization program. So we're going to be deploying the SP, the sulfadoxine pyrimethamine, through the EPI platform, to prevent these children from having malaria.